estimated 58.5 million U.S. adults who are living with arthritis and an estimated 25.5 million adults who have to limit their usual activities because of arthritis. These numbers are expected to rise as our nation's population gets older. Arthritis includes any condition that affects the joints, causing symptoms such as pain, stiffness, and swelling. There are two main types of arthritis, including inflammatory arthritis, such as rheumatoid arthritis and gout, and non-inflammatory arthritis, or osteoarthritis, which is the most common joint disease. Osteoarthritis occurs due to wear and tear on the joints and usually comes with age or following an injury. It's important that treatment for arthritis starts early. Treatment can include movement through physical therapy, aquatic therapy, or aerobic exercise, weight loss education to promote a decrease of stress on the joints, orthotics and braces for joints, or use of cold or heat. Cold can help with inflammation, swelling, and pain, and heat can help relax muscles and relieve stiffness. Treatment can also include medications or even surgery. Talk to your doctor for the best treatment options for you. For the prevention of arthritis, there are environmental factors that may trigger the condition, such as viruses, infections, environmental factors, hormonal changes, and smoking. So control what you can, eliminate tobacco use, limit alcohol intake, and manage your weight through physical activity and diet.
Physical activity is an important part of a healthy lifestyle. It helps to manage weight, prevent chronic disease, improve mental health, and help those with osteoarthritis or other conditions that affect the joints. Physical activity recommendations for those with arthritis are the same as those for the general public. Participate in 150 to 300 minutes of moderate intensity aerobic activity each week and engage in 2 additional days of muscle strengthening activities. Regular moderate intensity exercise has been shown to lessen pain and improve quality of life, and it may even help to prevent certain types of arthritis. Joint-friendly moderate intensity exercise, including cycling, brisk walking, swimming, light gardening, and dancing. Muscle strengthening activities include lifting weights, using resistance bands, or practicing yoga to increase overall strength and stamina. Flexibility and balancing exercises are also important. Stretching regularly will increase flexibility and improve one's ability to do everyday tasks. Balancing exercises like Tai Chi or practicing standing on one leg will help to prevent falls. It's important to change your activity level to fit the level of your symptoms. Start slowly and increase the amount of exercise that your body is comfortable with. Participating in joint-friendly activities safely within your limits and with a doctor's permission may reduce the likelihood of developing arthritis, or for those with arthritis, may help you live a more comfortable, active lifestyle.
In addition to engaging in regular physical activity, according to the CDC, the risk of developing some types of arthritis can be reduced by changing controllable risk factors such as diet. In fact, based on recent evidence from researchers, following an anti-inflammatory diet along with the medical treatment prescribed may be beneficial in the development and management of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease in which inflammation occurs throughout the body. There are foods that have been identified as having roles that either promote inflammation, known as pro-inflammatory foods, or foods that work towards decreasing inflammation, known as anti-inflammatory foods. Pro-inflammatory foods include those that are highly processed and are high in sugar, salt, saturated, and trans fat. Examples include beverages with added sugar or high fructose corn syrup, many baked goods, and red and processed meats. Anti-inflammatory foods are those that are low in added sugar and saturated in trans fat, and are high in fiber, omega-3 fatty acids, phytonutrients, and monounsaturated fat. A perfect example of an anti-inflammatory diet is the Mediterranean diet. The Mediterranean diet is based on the food cultures in and foods traditionally consumed in countries surrounding the Mediterranean Sea, including Greece, Italy, and Spain. More than food, the Mediterranean diet is a way of life that includes engaging in physical activity, social gatherings, and relaxation. Foods in the Mediterranean diet include fruits and vegetables, whole grains, seafood, nuts, legumes, and olive oil. Foods such as poultry, eggs, cheese, and dairy are consumed in lesser amounts, and a moderate consumption of wine with meals may also be a part of the Mediterranean diet dependent on a physician's recommendations.
For both prevention and management of arthritis, it's important to keep active while protecting your joints, manage your weight, and consider following an anti inflammatory diet such as the Mediterranean diet, embracing an active, social, and relaxing way of life.